Everybody, thank you for joining us for the virtual information session for our Masters of Science in Athletic Training. My name is Tom Kresh. I'm our Director of Graduate Admissions here at Commonwealth U Lock Haven. Thank you so much for joining us, whether you're watching live or you're watching the recording. This will be a great opportunity to go behind the scenes and learn more about our Masters in Athletic Training. I am joined by Dr. Jody Russell. Dr. Russell, would you mind introducing yourself and just telling us a little bit about who you are and some of your research interest and who you are as a faculty member?
Sure. As Tom said, I'm Dr. Jody Russell, and I am the program director of our Masters of Science in Athletic Training program. And I have been at the university. This is my 19th year, and I have actually served in the role of the clinical education coordinator for probably about 15 to 16 years. So I'm getting to see both sides of what athletic training is here at Commonwealth Lock Haven, with both the education being the program director and also the clinical side of it. My background, I went to school, my undergrads at Salisbury University and my master's in Valdosta, where I studied both health education and athletic training. And my PhD is from Penn State University, right down the road from us here. And my big research interest is actually in the area of concussions. A little side note is that I'm actually an independent medical spotter for the Big Ten. So I get to sit in the replay booth and just observe for any concussions or things that might look like a possible head injury. So that's probably my biggest area. I'm also interested in pedagogy, so like how we teach and innovative ways to teach.
Yeah, no, in Dr. Russell, that's so fascinating. And you know, one of the things I'm sure we'll talk about later on in the presentation is you know, basically just about how the field of sports medicine is just growing and growing and growing and getting bigger. And obviously that means the demand for people with an athletic training background is just going to continue to get stronger and stronger. But that's really interesting. I did not know that. Yeah, there's certainly a lot at stake here in this field. So the event should take probably around 30 or 40 minutes. I know that Dr. Russell has a tremendous presentation plan where we'll walk you through some of the details that you're probably interested in learning more about. Afterwards, we'll have just a brief Q&A. If anybody has any questions, please feel free to put them into the Q&A or in the chat, or if you're watching the recording, you can follow up with Dr. Russell or myself. We are happy to help, but I will go ahead and turn it over to Dr. Russell.
Okay, great. Thank you. So why the Masters of Science in Athletic Training? Specifically, I'm going to say at Commonwealth University Lock Haven. I think what we offer here, we have really a long tradition of offering athletic training education, both at the undergrad level and at the master's level now. Which is a requirement in order to sit for your certification. You have to graduate from an accredited master's program, which is relatively new. But we've been really doing athletic training education since the 1970s. So for a very, very long time. And we have a really rich tradition. We have a huge, huge alumni support base, which really makes it great for when you graduate then. There's always a job. We always get our alumni reaching out to us. They're always basically here to support you. And I think another thing is that we're not super large as far as our size goes, which is really nice because we can offer more of a family type of feeling here, and we really pride ourselves on having that family type of atmosphere.
Yeah, and Dr. Russell, you make a really good point there, because, you know, when you go to grad school, it is going to be different from undergrad, right, in a number of different ways. But one of the things that I think can be really helpful is when you're kind of progressing through grad school in this cohort model. Because remember, like, again, we're going to talk about this, the courses are delivered in person on the Lock Haven campus. And, you know, it just, again, it's more easier and supportive and enjoyable when you're going through this in a team aspect, right? Like you're going to have a pretty close community, tight-knit community of MSAT students. And I think, you know, that helps students, you know, get through the program at a higher clip, and they, you know, have more success in class because they've got this team of people that they're going through the program with. So that's a great point.
Yeah, 100%. They're spending a lot of time in these classes together, and then a lot of times they'll go on to their clinical together. So they become definitely each other's peers, and sometimes they'll go on and end up working together. So that's also a really a neat aspect of the program, because it is just really like a family type of feel.
Well, I did want to plug one of our other videos that Dr. Russell and some of her alumni had worked on. Is there was an alumni panel, and you could tell a lot of these students, they not only knew each other but were friends and colleagues because they went through the program together. They still keep in close contact. So if you get the chance to watch the alumni panel discussion, the video recording is posted on the athletic training website. You'll kind of get a reference for what it is that Dr. Russell's talking about. But sorry, I digress.
Yeah, that's great. Thanks. So just looking at our program, an overview here, we are accredited, as I said. Whether you're looking here or other places, you need to make sure that the program is accredited by the CATIE, which is the Commission on Accreditation of Athletic Training Education. And we actually just got reaccredited for 10 years this past year. So we are in good shape there. I think another really key part of our program is that we have an interdisciplinary faculty. So you're not just going to learn from people that are athletic trainers. You're going to learn from a pharmacist, from a physical therapist. We have exercise physiologists, and even the athletic trainers. We have our own specific line of research and areas of expertise. So as I said, I'm more in the concussion field, but we have someone who's really interested in biomechanics. And so there's a lot of different variety there. The other piece, which is a huge one, is that you can see that 100% employment rate. So that's always a really key factor. And well, are there going to be any jobs for me? And we'll talk about that a little bit later. But right now we have 100% employment rate. Also, our students, they'll take what we call the board of certification exam, and that's a requirement in order to practice. And we also have, with a 3-year aggregate for that, 100% pass rate too. So we're definitely preparing you to be successful in the field. We do offer, and this is a question that a lot of people ask, we do at the graduate level offer scholarships and graduate assistantships. So a lot of times they're like, I already am in debt from my undergrad. Now I'm going to my master's. How am I going to pay for it? We have scholarships that you can apply for. There's 3 of them to be exact that are specific for athletic training. We have the David Tomasi, an alumni scholarship, and the Yvette Ingram scholarship. And then graduate assistantships. Right now we have 3 assistantships for our students specifically, which sort of dovetail into a research area, anatomy, tutoring area, and one that's doing more promotion, social media, marketing. But we also right now have 2 other assistantships, 2 other students that are working in the rec department. So they're working and helping out to develop intramural schedules. So it's, there's definitely opportunities, and we work with you in that area.
Yeah, and I will say there are graduate assistantships that are available on an abundance of Lock Haven departments. They're not always in the fields. Obviously, there's probably a strong level of interest in a GA position that is connected to the subject you're learning about with athletic training. But there's there's GAs in the admissions office and residence life, and there's GAs across in athletics. There's plenty. So that it's a good opportunity to help offset the cost of your degree while also building a strong resume in the process. So again, if you want to learn more about those, I'm happy to help in any way. But thanks.
Thanks. And really, athletic training, there's a lot of different pathways to get to the Masters of Athletic Training. And really the best fits, but not saying that it's the only fit, is getting an undergraduate degree, whether it's in exercise science, health sciences, biology. I know we've had some that have been in pre-med. Psychology has actually been another route where some of our students have trickled in. And we'll talk a little bit later about the prerequisite courses. But it does not mean that in order to, pursue the Master's of Science in Athletic Training that you have to have a particular undergraduate degree. It's just a matter of making sure that you have the appropriate prerequisite courses to be admitted into our program. And then our space, and this is also, I'll let Tom plug another video, but we have a dedicated athletic training classroom. We have an exercise physiology And real innovative, real interesting to our program is that we have a gross human anatomy lab. So we offer cadaver dissection, which you don't really see that too often. And a lot of times people are now moving to more of these, what they're called anatomage tables, rather than doing the actual cadaver dissection. But we still strongly believe in that. It's important to see not only just the anatomy on models, but now you get to dissect and you get to see what it looks like really under the skin and what the muscle fibers and the nerve fibers all look like.
Sorry, starting to talk, I was muted. So athletic training at Lock Haven is kind of at the intersection of some of the programs that Lock Haven is most well known for, right? It's health sciences, it's the the pre-PA in our graduate program in physician assistant studies, as well as sport management and health and physical education. AT is kind of like rest in the middle of the Venn diagram. And one of the things that your students really benefit from, Dr. Russell, seems to be like the abundance of all these opportunities, this humongous ecosystem that exists because of that. One of those things, again, the anatomage tables in the cadaver lab. You're not going to see that at many other athletic training graduate programs. And really, that might only exist in the setting that I described with the Lock Haven ecosystem of these health sciences and athletic science and sports science programs. So again, it's honestly, you'd be hard pressed to find a better place to be for athletic training than Lock Haven because of some of those reasons. Yeah, but there is a video. Don't take our word for it. Yes, we have a video tour posted on the athletic training website. So if you wanted to, again, not take our word for it and just kind of go behind the scenes and view it for yourself, I would strongly recommend doing the video.
So then just looking at what our program actually really looks like, it's 60 credits. So that is spread out over 5 different semesters. And in that 60 credits, you have 45 credits of actual academic courses and then 15 credits of clinicals. And we'll talk a little bit more about what that looks like as far as the clinicals. Courses you can see are offered in more what we call a block format during the first year. So as we said, you have a cohort. So you will probably come in, usually it's around like 9 or 10 in the morning, and you'll have class until about 1 or 2 in the afternoon. And then that gives you some time then to get to your clinical. And then you'll be on clinical until practices are over. So that's really how we format that first year of your courses. And then the second year, it's a little bit different because I would say I consider them more of our ancillary classes because they're not as much hands-on as the first year is. Majority of the courses you can see are taught in person at our campus. The only course that is not taught in person really is our current issues class. And you'll see on the next slide, that's offered in our last semester, and it's an online course because you'll be off campus doing your immersive clinical. We do, as we were talking about the cadaver dissection, we actually have 2 semesters of the cadaver dissection. And we also have 2 semesters of musculoskeletal eval and 2 semesters of therapeutic interventions or treatment. And we break those down into upper extremity and lower extremity. So then we really can focus our time on one specific area rather than trying to skim over everything in one semester. And then, as I said, you're going to be learning from a pharmacist, you're going to be learning from an exercise physiologist, and they teach more of those, what I like to once again consider those ancillary courses, such as pharmacology, an exercise prescription and nutrition course. And we also have a sports psychology class too that's offered. So you get a little mix of everything that you might be dealing with besides just performing an evaluation and putting together a plan of care and your treatment and emergent care type of activities.
Yep, and that's another adjacent graduate program is the Master's in Sport and Performance Psychology, right? So again, that ecosystem just gets bigger and bigger, and because of that, we have some of these classes that might not be available at some other program. So that's the last time I mentioned that, I promise.
So breaking it down into those 5 semesters, we start in the summer, and we start what we consider our summer 2, which is typically around the beginning of July is when we start, and it goes until the beginning of August, which then sort of just gets you right into your first clinical. So that fundamentals of AT class really lays out, how to create an emergency action plan. What are you going to do? Because your first clinical is going to be in a traditional setting where more than likely you're going to get some football exposure. So you're going to have to know how to react in an emergency type of situation. We also teach concussion in that time because, once again, you're going to be gaining some experiences with football. You could be gaining some experiences with soccer, all of those that are more head injury heavy. But you also do CPR and first aid and splinting and spine boarding. So a lot of that is in this fundamentals course. You learn how to do some basic taping and bracing and padding. So it really prepares you to step right in on your clinical on day one, and you can be able to contribute. Even though you think you don't have a whole lot of knowledge, you at least are ready for some of that emergent care. So you can see year one, the fall and the spring, these are those blocks that we were talking about. So you'll basically be in class from 9 or 10 until about 1 or 2. So usually it's about 3 or 4 hours a day. And year one in the fall, we primarily focus on the lower extremity. So you're looking at how to evaluate a knee or an ankle injury. And then you're learning how to, you get to see that on the cadaver, and then the therapeutic interventions, you're learning how to treat them as far as applying different modalities. So you'll learn how to apply electric stim or ultrasound, and you'll know the why behind what you're doing. And then our first clinical, and I will wait to talk about the clinicals, which I think is on the next slide. And then year one in the spring, it's going to be primarily a focus on the upper extremity, and then therapeutic interventions too really focuses in on joint by joint rehabilitation plans. And then general medical conditions. So not everything we see is orthopedic. We see a lot of dermatological conditions, especially if you're working with a wrestling team. So these are some things that you learn how to see and identify. They talk about just general, cold. What does that look like? And eating disorders. Some of those types of things fall into this general medical conditions. And then year two, so you'll have that summer off actually between year one and year two. And then you start off in the fall, and you have your administration, organization, pharmacology, the applied sport and exercise science, which is more the exercise prescription and nutrition course. And then the psychology of injury and illness. So the sports psych piece of that. And as I said, those aren't really a lot of hands-on skills. So after year one, you've really learned your hands-on skills, and you're really getting to focus in and really apply those skills in the clinical setting. And then your last semester is the online course, which is the current issues. And then your last clinical, which is what most people look the most forward to with anticipation. So looking at what does that look like? So our first clinicals, the 1 and 2 during their first year, those are in the traditional setting. So that means you'll be placed at a high school or college in the area, or even potentially at Commonwealth U, Lock Haven. But we have a lot of high schools within about a 45-minute radius, whether it's really small rural high school or really a large, more suburban, urban type high school. We have Lycoming College and Penn College right down the road from us. And so those are Division III, NCAA Division III experiences. And then, of course, here is our Division II experience. And then we move to Clinical Experience 3. And this is really an interesting one where you spend some time in our rehab facility here on campus. So you'll spend about 6 weeks. So about half of your time is really honing in on those skills, those therapeutic intervention skills you learned the semester prior. So you might have someone who's torn their ACL and they're coming in to get rehab, and you're going to be in charge of creating their rehab and progressing them, and potentially even returning them to play, obviously under the supervision of one of the certified athletic trainers who would serve as your preceptor. And then we also have this medical model during this clinical, because you'll see in slides to come that athletic trainers are not just employed now in high schools and colleges like they used to be. They can be employed in an urgent care setting. So we actually have some time where you'll go to more of a general medical facility. So it might be a primary care facility or urgent care, and you'll spend a little bit of time with the doctor. We have some time where you'll spend at our UPMC Sports Medicine, where you'll get to spend a day with a foot and ankle specialist, a bracing rep, and you also get to observe orthopedic surgery. You get to do a little ride along on an EMS, so you get to see what it's like and see what maybe your role could be in that type of setting and how different professions work together. So we like to try to really invest in interprofessional education. So this is really a great opportunity for us to do that. And then there's also a local chiropractor that you spend a week with, because he does a lot of something called functional movement screening, which is a lot of preventative care, that's one of the domains of athletic training that we really focus in on. And then the last experience is your complete immersion. And this is where I like to tote a little bit on our program, because we started this probably about 12 years ago, and it just became mandatory for all programs to do this. So I think we are well above and started this way before anyone else really thought about it. And really it just came about because we had a student who needed another class, and we're like, oh, what should we do with the clinical? Let's go somewhere. So our immersion clinicals, we try to make sure that those are aligning with your professional goals. So if your career goal is to work at a Division I institution, then we're going to try to make sure that that's going to be where your clinical site is. And you definitely get some say in that. We have a laundry list of places where we've had students before, and we have agreements all in place. But if there is a place that you're like, I really want to see if I can go to this school, then we say, all right, well, here, why don't you reach out? And if it works, great. So this year in and of itself, with our current second year students, I think we have 8 new sites out of 11 students. So it's we're willing to work with you on that one.
Yeah, and I know you guys do a great job of helping put the athletic training community in the shoes of the students, doing these events. I know that there are really great like write-ups and highlights of the students that are doing. Like I've seen one at like Appalachian State seems to be one that comes to mind. There were ones at a number of other universities too that were done just within like the last 2, 3, 4 months. I remember reading the articles thinking this is great. Yeah.
Yeah, our students really enjoy the immersion experience. There's been so much positive feedback, not only from our students, but from the preceptors themselves, because it really gives the students more of this autonomy. And the idea behind the immersion really is to make sure that they're prepared to enter the workplace, because you're getting ready to make that jump. And so here you have a little bit of guidance, but it's a matter of, okay, well, this is going to be your team, and you take over the reins and go with it. But we're here if you need us. So it has been really a great learning experience, and something that our students definitely look forward to. And it's been a springboard for many into their first job, whether it's at that site or it's through networking that they then get a job through that immersion type of experience. So just some of our more recent immersion placements, and you can see a lot of our students, they wanted to get that Division I experience, because that's something that we really couldn't offer here with our Division II exposure here at Lock Haven, and at down the road with our Division III schools. But we've had people, you can see University of Tennessee, and she wanted a softball experience, so she worked with their softball team. University of Michigan, we actually have another student that's going there this coming January, and he's going to be with their men's lacrosse team. We've had several people go to the University of Miami. They've worked with their football team and their track and field teams there. Arizona State. So you can see now, we're really reaching across the country here with our internships. Clemson has been a mainstay for us for, I would say, at least a decade. And then right down the road at Penn State, they've opened up the doors, and we've had a student work preseason football there. And then we've also had one student and then another student this coming spring that's going to be working with their football team in the spring season, which really entails a lot of rehab, but they still get that exposure because they're practicing and they practice hard. So those are like the big Division I schools. But then we've also had someone at the Rothman Institute, which is more of a clinic type setting. And they got to work with some of the big wig doctors in Philadelphia that work with the 76ers and the Phillies and probably the Eagles as well. So they got some really good exposure, and they observed a lot of surgery as well. Sporting Kansas City, so now that's in our professional arena there. So you haven't heard of that, that's professional soccer. And we've had some people with the Philadelphia Union there. I wanted to highlight Orthopedics Associates of Lancaster too, because they not only have outreaches to a couple of high schools, but they also have a big arena called Spooky Nook. And if you haven't heard of it yet, you should just Google it. It is a huge complex that hosts a lot of youth clinics and tournaments, and there's basketball and there's volleyball and there's field hockey because it also hosts USA field hockey. There's climbing tournaments, so it's just an array of a lot of exposure. And then also we've had a lot of people at different high schools, so their career goal is to be at a high school, and there's nothing wrong with that. Sometimes people think that the high school, it has to be the stepping stone for the college. That's not the case, and it's not like one is better than the other. They're all rewarding, and it just really depends on what your own professional career goal is. So looking at then career paths, and as I said, more the traditional setting, you really think of college and university, our school districts, and professional sports. And that's really where we were for quite some time. But recently, we have started to merge into a lot of other settings because they're seeing the value of an athletic trainer in as an allied healthcare professional. So you'll see athletic trainers in the physician offices. You might see them in the hospital as well, because we can triage. So that the doctors can say, you know what, you are really an expert in orthopedics. You probably even have spent more time in orthopedics than I have. So I want you to do this assessment, and then you can let me know what you think, and we'll go from there. So they're seeing that that's a great way to really triage and have a better use of their time as far as the doctors, and they can be more efficient and see more patients. In rehab clinics, where we're seeing more and more athletic trainers working alongside, not underneath, but alongside physical therapists. Military, and I'll say with military too, you can add in the police, the fire department. They're seeing the worth of an athletic trainer. Not only, you think of a firefighter and all the heavy equipment that they're wearing, but they're also carrying that equipment too. And so injuries happen. Same thing with military. Injuries happen. So whether you're treating those injuries or you're trying to prevent those injuries. Performing arts, so things such as ballet companies, Cirque du Soleil. That's an interesting one, but you think about all the crazy stunts that they do. They have athletic trainers working there. And then also in the industrial setting. So you're seeing them on basically on the lines. They're helping with ergonomics, so making sure that their movement patterns are correct. So could be people have worked. We had one previous student working with Amazon at their distribution center. We've had a student that's working at Frito-Lay. So pretty much any Mack truck. So you see them really across the board, and it's really cool seeing how far we are branching out and being recognized, and people are seeing our worth. Which, with seeing our worth, that leads us to our job outlook. So new position growth, you can see, is expected to increase by 23% nationally. And in Pennsylvania, it's actually a little bit more than the national average, so 24% by 2030. So you can see you will not have a problem getting a job. The jobs are out there. And as people become more and more aware of sports-related injuries, that are occurring at a young age, the demand for athletic trainers just continues to increase. You see more athletic trainers being hired for youth sports now as well. So that's, I think, more of an up and coming area as well. A variety of work environment options. As I said, we provide educational services. So part of our domains of athletic training is wellness promotion and education. Ambulatory, you can see healthcare services in hospitals. You can see us in fitness and recreational sports centers. So something like the Spooky Nook, and even just plain spectator sports. So really the variety of work environment options. So if you're like, I really don't want to work in this traditional setting, there are so many other options that you can actually tap into. And right now there is a significant labor shortage. So the demand for athletic trainers right now is huge, which in a sense is a good thing, because you can see that salaries are increasing. So I think over the last 5 years, salaries have increased over 11%. And I think the average salary for athletic training right now is right around $62,000, which is above the national average of salaries, which I believe is at $56,000 to $58,000. So athletic trainers are making more than the national average salary. You're seeing sign-on bonuses right now. Just down the road from us, UPMC Susquehanna is offering a $10,000 sign-on bonus if you stay with them for 2 years. So Tom's like, oh, maybe I should go athletic training.
I know, I might have to send in an application. You might be reading my app soon here, Dr. Russell.
And what's nice too is that they're really improving this work-life balance. And I think this was a big thing as to why people weren't getting into the profession, or there was a steep drop-off, because they hear, well, I don't want to work 80 hours a week, or I don't want to work 60 hours a week. I want to have a family. And people are really, employers are validating the importance of work-life balance. So we're seeing more and more where there's not as much burnout anymore, because they want to make sure that, and it's a tough field. You think of these traditional settings in college and high school, there's a big demand, but they're trying to figure out how can we have a balance. And what's great is that when you graduate, you will probably have plenty of offers. So you can go and see what's going to be the best for me at this stage of my life. And maybe you're single, you have any children, and you're just like, all right, I'm all right to be a workhorse, and that's what I want to do. But you don't need to do that. And we actually really try to steer you away from taking those jobs, because we want to make sure that you're taking care of yourself. And you can see the benefits too are becoming, you definitely have insurance benefits. And part of what we do is we need to have continuing education units. So you'll see people that will help to, or employers will help to pay for those professional development areas. So where are some of our recent alums? As I mentioned, Orthopedic Associates of Lancaster, we have a graduate, I think 2 or 3 years out. He's actually the athletic trainer supervisor there. We have a student who is, or alum, I shouldn't say student, they're still my students, even though they're alums, but an alum that's at Premier Orthopedic Group. And he's working as an athletic trainer in this more physician type of office. So you'll see some athletic trainers referred to as physician extenders. They're still acting as an athletic trainer, but they're the extension off of a physician. We have people out there near the Pittsburgh area and Allegheny Health Network, Philadelphia Union, which is the Major League Soccer, Assistant Director of Sports Medicine at Shippensburg, Associate Athletic Trainer at Temple University. So now you can see we've got people in Division II, we have Division I, we have actually 3 of our alums at Roanoke College, which is a Division III school. And then we have students that are placed, or alums that are placed at high school. So at Canton area, which is north of here, she's a head athletic trainer there. So really they're all over the place. Yeah, and this is just giving you a snapshot of people primarily in Pennsylvania. But I wanted to throw the one in Roanoke just because we have 3 alums there, and I think that's pretty neat. And it's all worth that networking. One person said, "Oh, we have a job opening," and they're like, "You know who would be great? One of my peers from my class." And so that's how a lot of these jobs really happen.
Well, Dr. Russell, too. I mean, my guess is because of the reputation of the program, or do you have employers who reach out to you being like, "Hey, do you have any grads coming, being rolled off the assembly line?"
Constantly. We have, I would say I probably at least get one email a week from someone who is looking and says, "Can you please post this either on your Facebook page, or can you send this out to your current students?" So, and then too, as the time gets closer, like we're heading into March and April, those emails pick up. We get phone calls. So there would never be a reason why our students don't have a job once they graduate. That they're out there, and with our rich alumni base, um, it's pretty crazy.
Yeah, and that's where like the reputation of the program, the reputation of the faculty is becomes so important, is in making those connections. Like you don't realize, because you hear so much about the importance of connections, it almost becomes just like white noise, like just like wallpaper. But like that's a perfect example of why it is so important. It's because people are like, when they think a lot, athletic training, they think, "Ooh, Lock Haven." When they think Lock Haven, they're like, "Oh, Dr. Russell. I know I have her information. Let me send this to her." Right. And then they kind of you have an in. Right. And
Yes.
sometimes it's like, "Oh no, we've hired someone from this program before. I know the value of this program. Yeah, we want to get them to the top of our interview list." You know what I mean? So like that really is important.
Yes, 100%. And right now we do, I failed to mention that we have 5 athletic trainers that are part of our core faculty. And we have all been here. I think the one that's been here the least, this is his 17th year. So we are well established, and we have, like I said, a huge alumni base where pretty much anyone that has graduated through this program has either had us, or the person that has the most seniority went to school here. So we have 3 alums from the program that are current faculty here. So it's definitely a tight-knit community. And as you said, with a really well-known um, program, tradition of excellence, um, they want to hire our athletic training students. So how do you apply that? So there is an online application. So you can reach that on the graduate admissions page. And that's, well, I'll start there. That's really more for 3+2 applicants. There's a program called ATCAS, and that's also where you'd want to go in and actually fill out your application. ATCAS branches out, and the graduate admissions is then notified once they get on ATCAS. So Tom's not interrupting, so I'm on the right track.
Oh, yeah, I'm sorry. Yes, no, that is absolutely correct. Yes. Sorry about that.
No, you're good. We would require on the ATCAS application, and like I said, that's more a central location, so you could apply to us. If there was anyone else that you might be interested, you could apply there as well. We would require your college transcripts. For the graduate admissions, graduate school, you are required to have a minimum of a 3.0 GPA. If for whatever reason you're teetering right on that, case by case basis, we will potentially still interview you, and there's a potential that you could be put on a probationary status, but really we try to keep that at that minimum 3.0 GPA. And then there's also specific prerequisite courses. Those are listed on our website, but there are classes like AMP 1 and 2, a biology class, a chemistry class, a physics class, nutrition class, and a psychology class, and then biomechanics and exercise physiology. So those are the required courses, and statistics. Right now, there's no GRE required, so you don't need to worry about taking that exams. You can save some money there. And we do require that you have 2 professional references. and that we could potentially contact, and then a statement of professional goals. And after you have completed all that in your application process, the faculty will then set up a time to interview you. So that way you can ask us any questions that you might have about our program, just to make sure that it's going to be a good fit for you. And then really on our end, it's just a way for us to get to know who you are. And that also gives us a good time too to talk about any like the graduate assistantships that we might have available, etc.
Yeah, there's not a ton of barriers separating an interested student. Basically, it's you're looking for, college academic success in certain majors, but other than that, there's not a lot of, again, like barriers, like, oh, I got to do these 5 things to certify that I know this, that like basically we need your transcript, professional references and, a statement of professional goals. Most of those things are not going to be super labor intensive, other than just doing well in your school, in your classes. Right. Again, no GRE, no GMAT, nothing like that. So it is pretty simple.
Yeah, and the interview with faculty is on there. We would have that, and we can entertain doing that in multiple different modes, whether it be via Zoom or on person or in person. And we really highly suggest that it's actually in person, just so that way you can get on campus and get the feel of the area, and also just to spend some time with our students. I think it's valuable to be asking them questions. It's one thing to hear me, as a faculty member talking about the program, but I think it's really good to ask maybe some of those more intimate questions to the students. So, and that's my information. So you can feel free to contact me. And any questions?
So I know, one of the more common questions that I hear from prospective students a lot is, what is the difference in coursework, right? Like, what's the difference in between a graduate level class in athletic training and an undergraduate course in athletic training or health sciences or biology? Like, is it more research? Is it more reading? Is it more writing? Like, is it more hands-on? Like, what are some of the things that you would use to distinguish between an undergraduate and graduate level course in this subject?
Sure. I think in this subject, a lot of it is application and critical thinking. So we're going to teach you the information. This is how you do an evaluation. But we don't want it to be cut and dry like that. So we're going to then, okay, let's do a practical with that. But also now I'm going to give you a case scenario, and you have to work through the scenario. So now not only do you have to make what we call like a differential diagnosis, think of what are your three reasonings, or what are your 3 potential injuries, and give you a rationale. But now then I want you to set up a treatment plan. So now it's like taking the next step. And we do a lot of different fun things. I think they're fun. The students might get a little stressed, but we do something called a standardized patient. So it's very similar to doing a practical, but you're actually videoed, and you get that opportunity then to watch yourself, which students really don't like to do, but it gives you great information on your interpersonal communication skills, and how you're interacting with the students, which then is like a platform for you to make your clinical goals for the next semester. Like, you know what, I think I really need to work on this. So it is a lot of reflective thinking, but I really think a lot of it is application. You're learning it in the classroom, and now you're going to actually apply it in the clinical setting, rather than with undergrad, you're just reading and, okay, I might practice taping, but now you're answering the why questions. Why am I doing this? What's the rationale to it? And really, it's like we're expecting more of that critical thinking, clinical reasoning skills. And there is quite a bit of reading, I'll say that, but I really think it's the application and just trying to figuring out the why, rather than memorizing. Like with anatomy, you just memorize. Okay, I'm going to memorize all the bones, and I to be able to identify them, and I will identify all the muscles, and I'll memorize that. But now you're saying, how do those all work together?
So, well, yeah, thank you, Dr. Russell. So, you mentioned the anatomage table. You mentioned the cadaver lab. As an athletic training student, what are some of the things, like, what are some of the, like, what are you doing in that, right? Like, what are some of the projects you're working on? Like, can you give us a couple examples of how students might be interacting in the cadaver lab or with the anatomage tables?
Yeah, and I can speak probably more so to the cadaver lab, just because the anatomage is tables are new here. So I haven't really seen the interaction of those yet, but I know with the cadavers, one really neat thing that they'll do is that if we're talking about an ACL tear in class and you're learning how to do the test on, and we have tables where you're writing and then all of a sudden you're jumping on the table because we have nice mats on there and you're trying on your partner to feel this test. So,
Mhm.
okay, let's go down to the cadaver. Let's cut the ACL. And now let's see what it would feel like on someone who's actually torn their ACL. So you get to like really test out um, all these special tests that you're learning on the cadaver. So it's not just let me look at the bones, let me look at the muscle, let me look at the nerves and that. Now you're saying, okay, what would a positive test feel like? How is this joint supposed to move? And you can manipulate the joints a little bit on a cadaver, where that's something like you just can't gain that experience anywhere else, other than in a lab like that. Um, and then the anatomage, I know that they're really working on like, okay, how do we get to the next layer? And let's keep on uncovering the layers. And this way you can manipulate that and really get a bird's eye view of that anatomage, and of that person on those tables.
Yeah, no, that's super interesting. And so then my final question, Dr. Russell, then is, you talked a little bit about your research interests, right, in some of your academic interests. If you had to pick one class that's your favorite class to teach, you only get one. I've heard, some graduate faculty for these, like, oh, I can't pick, it's like picking one of my kids or like, something like that. Like, if you had to pick one, what's your
Yeah.
favorite, like, what's the thing, like, oh good, I get to teach this today? It could even be like a unit. Like, what's your favorite like unit or section of a class to
Okay,
teach?
that's even better. It's definitely the concussion unit that I teach
Oh,
in
interesting.
in the fundamentals class, because it's not only am I incorporating the concussion eval, but I'm also incorporating concussion rehab, which is relatively new. So it's really fun, and a lot of times people don't think of rehab with concussions. They think of, okay, if you sprain your ankle, you have to do rehab, but this is something like, yeah, you have a concussion, you should be doing rehab. You need to help the brain heal. So it's a lot of fun.
Yeah,
I'd say one other thing, I am going to pick one other thing because it's a highlight of the students. I think is I get to teach the aquatic therapy lab. So we
oh,
get to jump into the pool and we get to have a lab in the pool. So it's just different. So it's fun.
yeah, that's it. Will, and I think, first of all, that does sound pretty fun. But the concussions is, I mean, because the science is evolving so quickly, just in the last 10, 15, 20 years. I mean, even in the last like 2 years, it seems like things are evolving exponentially. So yeah, it seems like that's a good topic for a faculty member in this program to be a leader, a thought leader, and is because that's something that every medical professional is going to have to be, anyone who's meeting with patients is going to have to be prepared to talk about those things and be versed in that. So
Mhm.
that's, yeah, super
Yeah.
important. But well, thank you, everybody. Again, whether you watched live or you watched the recording, we really do appreciate your time. Please don't hesitate to contact Dr. Russell and myself. We work for you and we're happy to do so. So we, look forward to hearing from everybody in the future, and I hope everybody has a good night.
Great. Thank you.